My name is Carbonilla-Nasal-Suction, and I will be doing the oropharyngeal and the nasal pharyngeal secretion checklist. Now, the purpose of this procedure is to suck out airways or obstructions between in the airways so the baby can breathe. It could be phlegm or anything, usually phlegm. Yeah. Before starting the secretion, we're gonna have to assess the needs for secretion. First is we're gonna have to check the respiratory. We're gonna assess the respiratory. Next is we're gonna see if there are chances of hypoxia. Next is we're gonna be assessing if the baby can secrete their own secretions adequately. And next we're gonna assess the chances for low oxygenation or if the baby may have a hard time breathing. Now, before starting, we should always remember to perform a baseline respiratory assessment. We're going to be checking if the baby can breathe well, if the chest goes up, can breathe normally. And what we're going to be doing is we're going to have to position the patient. By positioning the patient, the purpose of this is when we're going to secrete or when we're going to remove whatever secretions are inside, it would be easier for the baby. Now, next is we're gonna have a proper hand washing technique. Get the important things that are needed. And for this procedure, we should prepare, first and foremost, we should prepare a suctioning machine. This is my makeshift suctioning machine. You can see, we'll just assume it is a suctioning machine. Next is we're gonna be getting a canister or a catheter, a canister. But what I was gonna use was this, but I already opened it eventually. But this is what we're gonna be using, a canister. Next is we're gonna have lubricant. Or sometimes sterile water, which is actually way better. Gonna be sterile water in a, let's say, in a pan that we're gonna be using to help clear out the secretions inside the tubing. Will be explained later. Next is we're gonna have to prepare some PPE, which is sterile gloves, and a face mask, which apparently, and a gown, which apparently I do not have at the moment. Now, so if the baby is having a hard time breathing or lacks oxygen, what we should do is we should oxygenate the baby to avoid risks of hypoxia. Make sure that the suction setup works. Before starting, we should have to estimate the depth of suctioning. So from estimating it, we have to always remember when we're gonna estimate the length, we're gonna have to it has to be still inside its sterile container to avoid infections. So when doing this, we have to measure from the nose. We can measure from the nose to the earlobe, or the nose to the mandible. Now, what we're gonna do is we're gonna turn the suction device on, and at the same time, a vacuum regulator to appropriate negative pressure. It's either medium or moderate. Next is we're gonna attach the suctioning catheter to the tubing while it's remaining in its package. As you can see, it's in a sterile field. It's still in its sterile field. Now we're gonna expose the suction catheter enough to allow the dominant hand to grab the catheter, the sterile catheter. Now what we're gonna do is we're gonna wrap the sterile catheter around the dominant hand, and what we're gonna do is we're gonna start suctioning the sterile water. And from that, we can put lubricant if it's necessary, lubricants like this. But sterile water, and then that's what we're gonna use on the baby. So now this is my catheter. Now what we're gonna do is it's either we put it on the nasal or the oral. In this case, I'm gonna be putting it in the oral. What we're gonna be doing is open the baby's mouth, and we're gonna have to feel it until we can feel the pharynx and if there's resistance. Now we're gonna apply the intermittent suction catheter. Okay. Now we should remember, we shouldn't apply the suction for no longer than 10 to 15 seconds because the possibilities of the suction to suck out the oxygen is dangerous for the baby. Now we should also replace the oxygen device on the newborn. And when the baby has a hard time breathing, in case the oxygen runs out, we're gonna have to replace the oxygen delivery device on the newborn baby. This is a makeshift one. You can ask assistance from that from a nursing assistant. Now what we have to do is to clear secretions. You should always put a sterile water bottle, the sterile water to clear out the suction to make the tube patency clear. Then we're gonna repeat the process again till we remove the secretions. And we have to observe the changes of the cardiopulmonary status of the baby. Now for the bulb syringe, this is my makeshift bulb syringe. Something like this, you have to squeeze it and it will suck the air out. Now what we're gonna do in the bulb syringe is exactly like the same process as the secretion machine. But what we do is, before putting it in the baby, we should squeeze it on. After squeezing it, we can either put it on the nasal or on the mouth. And after that, we release the ball, and then the air will go back to the bulb to get the mucus out of the nose or in the mouth. Now what we should do is we should always record the amount and the consistency, the odor, the color of the newborn baby. And we are done with the checklist.